Vicki, thanks for coming today and talking with me about our early experiences together. We've known each other for the past 14 years, and I wondered if you could just give a few details about how we first met, where and what the circumstances were.
Okay. I had a nocturnal seizure in August of 1998, so a long time ago, and I went to the hospital, went to Riverside because my husband requested. That's where we wanted to go. We had a lot of good experiences at Riverside. So we went there in the ER, and they found anaplastic astrocytoma, a brain tumor. And the Dr. Baraducci, who was chief neurologist for the ER that day, fortunately, he was really a great guy because he was so nice, and even though it's vague, some of the thoughts go in and out of what I remember him. And so then he directed me to you.
And the tumor was in the right front part of your brain, I recall. And you know, that's the kind of news that you don't want to get, that you have a malignant brain tumor. Do you have any memories back at that time of talking about it, the circumstances of your hospital stay?
After surgery, we went over to the hospital, and we were in a double room. And there was another woman in there who had gotten thrown down the stairs by her boyfriend and broke her back. And he threatened that he was going to come over to the hospital.
So that's clearly when we want to talk about one part of your experience that could have been improved in dealing with lots of patients who have the diagnosis of malignancy and having to tell that to the family. I have always had the habit of taking them out of the room and talking in private. But yet, when you deal with that, you have to go back into that double room. So, you know, it limits the visitation. It's just not the ideal thing for the
I could see
quality
that.
Experience, you know. In looking at the plans for the new building, what about that do you think might improve the experience that you had in 1998? What about the center?
Definitely having my own room would have, and being kind of close by everybody, so everybody connected.
Because as I recall, you had to go to one office to get your chemotherapy treatments, and then to the hospital to get radiation, and then to my office to see me for follow-up, and back to the hospital for your MRIs. So, you know, one of the nice things about the new facility is that all those things will be gathered together within 2 floors.
And you won't have to worry about where you're going. And it would be really nice for those I'm from the Columbus area, but there are people who are out of town or out of state who probably come in to see you, and they don't know where to go.
The treatment for a malignant brain tumor is about 6 weeks of radiation therapy. And
a year of chemo.
Yeah, a year of chemo. So that's a lot of trips back and forth. And if we can get all of those services in one smaller
place.
area, like you said, for wayfinding for the patients, it'll be much easier.
Yeah, less stressful equals, you know, better experience.
Yeah, I agree with that entirely.
But you're improving. That's what this hospital building, not just the building, what is in the hospital, will really improve.
Vicki is just such an unusual patient in that she's had such grace during all of the treatments that she's gone through. You know, I was thinking we've gone through the best of times and the worst of times together. And now the best of the times is to come together every 6 months and find out your scan is normal and that you're doing so well. So you're a big success story.
Well, I believe that. I believe that. And I get to hear about about the Buckeyes and the Reds. You know, we get to catch up on how they're doing.
Yeah, you can't have a patient-doctor relationship like this without developing a good relationship. So, well, thanks again for coming.
Oh, you're welcome. I'd do anything for you.